Welcome everybody to once again another informative edition of Glaucoma on Radio, proudly brought to you by the Eye Specialist Hospital Tash in collaboration with Solid 100.9 FM. Chibika James is my name, and it's always a pleasure having you all join us as we continue our mission of creating awareness about glaucoma and helping people understand the importance of protecting their vision. Now, when we hear the word glaucoma, many of us immediately think about older adults. We think about our parents, grandparents, or people well into their later years. But here is something every parent needs to know. Glaucoma can affect children too, because childhood glaucoma is uncommon, but when it occurs, it can seriously threaten a child's development, or will I say, it can affect the child's developing vision. And because young children may not be able to explain what they're experiencing, parents and caregivers have an important role to play in recognizing warning signs and seeking medical attention quickly. A baby may have unusual large looking or cloudy eyes. A child may constantly tear, avoiding bright light, rubbing their eyes frequently, or appear to have difficulty seeing. Now, these signs may be mistaken for something minor, and sometimes a parent may simply assume that the child is outgrowing the problem. But when it comes to childhood glaucoma, early recognition and treatment can make a major difference to the child's visual future. And if I'm to even say, according to the National Eye Institute, congenital glaucoma is rare, but typical signs can include cloudy eyes, sensitivity to light, excessive tearing, and eyes that appear larger than normal. And that is why today's conversation is so important. We want our parents to understand what childhood glaucoma is, what warning signs to look out for, and when to seek professional help and also why early intervention matters a lot. Well, ladies and gentlemen, today's conversation is childhood glaucoma. What every parent should know. So, if you're a parent or aspiring to be a parent, because every one of us will one day be a father or a mother, or if you're just listening for knowledge's sake, we want you to pay close attention because today's discussion is gonna worth your time. And joining us to understand this important subject is a distinguished eye care specialist from the Eye Specialist Hospital Tash. And yes, this morning we cannot wait to hear from her. Right here in the studio, ladies and gentlemen, we have the lady talking about Professor Nkiru Kizo Akerwe. She is someone who has always been here very often, and yes, whenever she comes around to talk to us, we do not take her presence for granted. Prof, good morning, and good to have you on the program.
Good morning. Good morning. It's great to be here again.
All right, good to have you, Prof. And definitely, ladies and gentlemen, Prof is not coming for the first time. Yes, you probably would not hear her all the time, but yes, whenever she's here, know that yes, she is here for something huge. And yes, today we are pleased to have you in the studio with us. Also, Prof is a consultant ophthalmologist, Isut Teaching Hospital, Park Lane, Enugu, and she's also governor representing Africa World Glaucoma Association Board of Governors. So you see, we have someone huge right here in the studio. Let's start as always with the basics, ma'am. For those who are just listening to this program for the very first time, glaucoma, and why is it that the eye specialist hospital have taken it upon themselves to always be here Fridays 9 to 10 a.m. educating our listeners about care of the eyes?
Thank you very much, Chibuike, and good morning, dear listeners, and thank you for joining us again today. Glaucoma, it's a problem, a public health problem, actually, at this stage, because it's the leading cause of irreversible blindness. Now, it's a problem to be blind. And when somebody is blind, it's bad enough. But when that blindness cannot be reversed by any means, then it is a double jeopardy. So, and that's what glaucoma represents, the major cause of irreversible blindness. And it's worse among blacks, like 4 to 7 times worse, more prevalent among blacks than in our Caucasian counterparts. And when it starts in the black, it starts earlier, it starts at a younger age, is more aggressive, and it leads to blindness earlier and faster. So we are concerned about glaucoma because glaucoma is symptomless. So glaucoma has a nickname of the silent thief of sight, and that is really what describes it. It steals someone's sight silently, and the person doesn't know that there's a problem. So in our last national survey, 95 out of 100 persons who had glaucoma did not know that they had it. It's as bad as that. So out of 100 people who had glaucoma, 95 of them didn't know they had it. So just to bring out how silent it can be. And somebody says, no, there's no problem, I see very well, I don't have a problem with my eyes. And yet something is there damaging the nerves for vision, and the person doesn't know. So what does glaucoma do? Glaucoma is an eye condition that damages the nerve for vision slowly but progressively.
Slowly but progressively.
Slowly but progressively.
Interesting.
Now, and it is painless. It's symptomless, especially in its early and moderately advanced stages. It's towards the end of its course that it starts giving signs of it being there. And that is why it's a silent blinder. Above 35% of our patients, or about that, which is like 3 to 4 out of our glaucoma patients, come in already blind in one eye. Meaning they didn't even know. But because one eye was seeing, they didn't even know the other eye wasn't seeing.
Wow.
And it's until the remaining eye is about to go and they start having blurred vision, they now know that they now seek medical help. And our people will first start with their neighbor in the compound.
It's my uncle.
That says, I'm not seeing well, and that one will now give medical advice that don't worry, it must be cataracts. And cataracts, they don't operate on it early, according to him. And then so wait until it's serious, then you can go. So by the time somebody is now coming to the hospital with an only eye, what is remaining is bad, is very little. So and that's why we are creating awareness, and we can't but appreciate the management of Solid 100.9 FM continually for the opportunity to do this service they're doing to our people. Knowledge is power. So if somebody knows that there might be a blinding condition that is silently damaging my nerves, and it doesn't let me know in any way, there's no pain, there's no redness, there's no itching, there's no blurry vision until it's about blinding the eye. Maybe 4 out of 10 might decide to have their eyes checked to make sure it's not there. So that's the challenge that glaucoma poses. Now, glaucoma in our country, it's quite common. Like I said, it's much more common among Black Africans. Now, and it's also much more common 40 years and above. But for those 40 years and above, in the country, 1 out of 20 people, 20 adults, 40 years and above, have glaucoma, whether they know it or not. Now, but when you come to the Southeast, 1 out of 13 adults have glaucoma, whether they know it or not. So it's much more prevalent in the Southeast, which we feel has to do with some genetics thing.
Right.
So but apart from adults that are being affected, we are talking today that it also affects young people.
All right, yes, that's just to give you a foundation of what we, will be talking about. And yes, it is all about children this morning, childhood glaucoma, and what every parent should know. Prof, when we talk about, childhood glaucoma, you said it, that it also happens to children. But I would want to know, the same glaucoma that we commonly see in adults, is it different from what we get to see in children as well?
Yeah, thank you for that question. Now, glaucoma, if I didn't define it the way we define it, I just explained what it is.
Yeah.
Glaucoma is actually a group of eye diseases, but they have a characteristic pattern that they damage the nerve. So all of them damage the nerve, and they have a characteristic way they damage the nerve, and a characteristic way they present, and a basic principle in how they in how they are managed.
Okay.
Now, in children, when we talk about childhood glaucoma, it spans over a large period of age, from birth to like 35 years, of age. So we have the one somebody is born with. Yeah. So somebody can be born with glaucoma.
Wow.
Yeah. And
so it's passed from parent to child?
Not necessarily.
So you came into this world and boom, your eyes problem.
It happens, and
wow.
it really does happen. Yeah. And so when we say we like not to say it's rare, because we rather say it's not common, because rare and not common there might be some slight difference in it. So a child can be born with it, and then a child can also develop it.
Wait, sorry, I want to understand this your statement of saying a child can be born with it. Let's say, for example, the mother does not have glaucoma.
Yeah.
Give birth to a child. Can the child be born with glaucoma?
Exactly.
Whoa.
Exactly. Most of the children born, their parents don't have it.
Wow.
Yeah. The ones that the children, maybe the parents would have, and they develop it, they often don't present at birth. Yeah. So, but when a child has, it's mandatory to check the siblings. Somebody might be brewing one.
Wow.
So we have the childhood glaucoma, we have what we also call developmental, that a child develops as they grow, and then we have what we call juvenile onset glaucoma.
Okay.
Okay, or juvenile open angle or normal angle that develops, that's the one that stretches like from 15 to 35. Okay, so but when it develops in a child before 2 years old, okay, there's a characteristic way it presents, and those are the features you talked about earlier. So, but I'll go over them for the sake of our listeners. So, when the eye, the white of the eye is an elastic structure. By 2 years, it stops stretching out. Yeah. So, if there is glaucoma before that time, the eye will stretch so as to accommodate the increase in pressure. Now, let me liken it to a balloon that somebody is blowing.
Yeah.
If you're blowing in air, you're increasing the pressure within the balloon.
Yeah.
And so it causes it to stretch because the balloon is elastic. So it keeps stretching. There's a level if you overblow, then it could burst. Okay, for the eye, that structure that is elastic, while it is still elastic, if the pressure within it increases, it stretches. If pressure increases further, it stretches. So but after 2 years, it doesn't stretch. Okay, so if a child has glaucoma before 2 years, the eye stretches, and when it stretches, the child's eyeball begins to look larger, and the glassy part of the eye has a beautiful arrangement. So when that stretch happens, and it stretches, the white is stretching, so the glassy part is caused to stretch too.
Yeah.
It cracks it.
Whoa.
And when it cracks it, it causes pain, because that part of the eye is very sensitive, has a lot of nerves. So it causes pain. The pain causes tearing. And then when it heals with a scar. So gradually, so a child who has glaucoma before 2 years and starts having that enlargement will be tearing because of that cut. We tear, and we not like lights, because when they come out to the light, it causes pain. So there are some mothers who say, this baby, once I bring the baby outside, starts crying. But once you enter inside the room and it is dark, the child will be happy. That's a warning sign. When you see that once you bring out a child outside, the child, even if the child is not crying, the child closes the eyelids and refuses or bends the head down, and you'll be trying to push up the chin, say, see your auntie, see your grandmother, see the child is bent down, and if you force the chin up, the child's eyes will be closed. But when you enter into the room, the child opens the eye. That's a warning sign. If a child is tearing excessively, and it's because of that pain, that's a warning sign. If the child, you feel that the eye is too large, is looking large, sometimes when it looks large, some feel, see, fine eye, this round, this child, the eye is so large, check it out. Because of that stretch, the eye gets bigger in size. In eye world, we call it bull's eye. Because the bull, that is the
The
cow,
animal.
it
Yeah.
has large
Yeah.
eyeballs. So because of that stretching, the eyeball gets to be large. If the two eyes, one pressure is more than the other, the one with higher pressure will be bigger than the other. If it is affecting only one eye, sometimes it affects only one eye, then that one eye will be bigger than the other one.
Interesting. You gave us a statistics earlier as to how common it is in older adults, as to how common it is with those in the southeast. Is there any statistics to back how common it is with children?
Yeah, for children it's so much less. Like 1 in 500,
But it
10,000. Yes, I
happens.
bet it happens. Yeah.
Okay, okay. Let's talk about the warning sign, because you painted a scenario and said those are warning signs.
Yes.
Uh, what should parents look out for in a baby or even a young
A young
child?
child.
You've highlighted a few, but I want you to dive a little bit deeper, particularly in excessive tearing, sensitive to light, cloudy eyes, or just that large looking eyeballs. Are these only the things they should look out for? If they see it, run to the
Yeah,
doctor.
yeah, yes, those are the major things for small
Major.
children.
Are they
Yes.
minor things?
Well, nothing that those ones are left for. So if you look at the that transparent part of the eye that covers the black area,
Yeah.
yeah, it's supposed to be like glass, transparent glass. Now, if you see that it is whitish, it is hazy, it has white marks on it, then that's a problem. So that's also a sign. That's one of the signs. So it's so important. So what you've just mentioned, having teary eyes or watery eyes, being sensitive to light, child preferring to be in the dark, and then the hazy cornea, that transparent area, we call it the cornea, hazy, and it's whitish or grayish, you need to see the eye doctor. It's better to be safe than to be sorry. And it's I know that will maybe come later to treatment and all that, but let me just drop it here that childhood glaucomas, when they happen, the main treatment is surgery.
Surgery.
It's surgery.
No
No,
drugs.
no
No laser.
drugs. None. I mean, there are, but they are like mild stop gaps until you do surgery. If not, that child will lose vision.
Wow.
So I'm dropping it here because occasionally some children have been found to early enough, and either the person providing the care, doesn't advise them appropriately, or the parents decide that no, how can a little child like this have surgery? But that is what we save that child's vision.
Okay, Doc, before we go to family history, because you mentioned it earlier on, for the purpose of this program, okay, it is to make everyone understand that yes, glaucoma can happen to a child. What would you like parents to understand about the fact that glaucoma can occur in infancy, childhood, or even during teenage years?
Yeah, first of all, one, to know that it can occur, and so you don't feel no, now this one is an adult disease only. No. So two, when you have opportunity, like children when they are entering school and all that, the schools often ask, go and do your medical tests and bring, and then they take it to some doctors sometimes and say, just feel it for me and sign. That's a lost opportunity to check out the eye. So if you at each, so that gets done maybe in entering primary school
Or
and
secondary.
entering secondary school.
Yeah.
It's an opportunity to have your child's eye checked. Most childhood glaucomas have raised pressure, most, unlike the adults. But most childhood glaucomas have raised pressure. Before, we thought that all childhood glaucomas had raised pressure, but we've seen in the latter times that you could have normal pressures and still have glaucoma in children. Now, children, I'm talking when it comes to glaucoma. Remember, I talked about the juvenile open angle or juvenile normal angle glaucoma, angle normal tension glaucoma. Sorry, and it ended in 35 years. So when it comes to glaucoma, we group 35 years and less under childhood glaucoma because of the way they are handled, in terms of treatment. So that is one very important thing. It's important for parents to know that when you have opportunity to have your child's eye checked, because it is required, do have it checked. And at any point in time that you think that a child is not seeing well, either by yourself or the teachers in school complain, or you look at your child's notes and it's not being well written, and the child says, I don't see the board well, or you see the child do like they are not seeing well, don't take it lightly, because those are very important signs. When you remember that after 2 years, the typical signs that presents itself, remember we said that glaucoma is symptomless, but in the baby it's not. So 2 years less, it will show you it's there, but after 2 years it doesn't tell you it's there. So, and the child will most likely not come and tell you,
no, at that point, they don't know
I'm not seeing well. They don't know. So, but you, the parent or caregiver who watches your child, either the child is, if you put the child far from the TV, the child must come closer. You say, can't you see? Say, no, I'm not seeing it. Don't take it lightly. Just go and cross-check.
Someone say, confront.
That child has a whole life before them. And they need their vision. Don't play with that. So if you observe your child and either the child bumps into objects or to see something in a particular, they have to turn the head to be able to see something well, know that it is a problem. Or you're giving the child something. If you give the child something from the right corner, the child doesn't seem to be seeing it, unless you're giving, I'm not talking of you're giving it straight on, you're giving it from the right corner and the child doesn't see, but sees if you give it from the left corner. Don't take it lightly. Take the child for an examination, because glaucoma affects all ages. It affects all ages.
From day one, sir.
From day one even. So that you see it in day one means it started from the womb, isn't it? Yeah.
Interesting. Okay, I'm sure our listeners are paying attention. Well, ladies and gentlemen, if you're just joining the conversation, it is Glaucoma on Radio right here on Solid 100.9 FM, a program proudly brought to you by the Eye Specialist Hospital Tesh Enugu in partnership with Solid 100.9 FM. And yes, today we are discussing childhood glaucoma and what every parent should know. Chibike James is my name, and in the studio we have Professor Nkiru Kizo Akeriwe. She is a consultant ophthalmologist at Isut Teaching Hospital, Park Lane, Enugu, and also governor representing Africa World Glaucoma Association Board of Governors. So having talked about what this childhood glaucoma is all about, let's take our conversation further to family history. Doc, if a parent or a close relative has glaucoma, does that mean that their children are automatically going to develop the disease? And should children from families with history of glaucoma have their eye examined, differently?
Um, if a parent has glaucoma,
Mm.
it doesn't mean that the the children will automatically have it.
Mm.
Yeah. One out of the children may,
Okay.
two may, all may,
Mm. None me.
and none may.
Okay.
Yeah. So, and it might skip that first generation
Oh.
and appear in the second. Yeah.
Ah.
So it's once there's a family history, is a risk factor.
Hmm.
Yeah. So, you know that you're at risk. You're at risk, and what you owe yourself, and your family, and the community, is to know that if one person has been found to have glaucoma, whether it is in the parents or in the child, that the whole family is at greater risk. And
Hmm.
so everybody should check.
Hmm.
And you don't just check once, you check, we advise, check once a year. For children whose parents have, for our own environment, we advise check once a year from 10 years. Now, we could say from for the childhood, you can do once in 3 years. But because people will forget, for something not done frequently,
Yeah.
our healthcare system is not such that maybe the place will call you and say you are due for your appointment, send you a reminder. So to make it easier for you to remember, we say do it yearly. It doesn't cost you a leg and an arm, but it prevents you a lifetime of sorrow.
Interesting.
Yeah.
Interesting. Now let's get into the discussion proper. Well, ladies and gentlemen, we would open up the phone lines. We see your calls already, so just hang in there. We would open up the phone lines pretty much soon and take your calls and get your, reactions. Let's go into the treatment because we have identified the problem. We've talked about the effects and how it affects young children. Now let's go to the treatment, starting with the eye examination. You said once every year. Are there cases where it could be done even more than once a year?
Well, if the risk factors, when you see somebody and it's, there are some persons categorized as glaucoma suspects.
Mm.
When somebody is categorized as a suspect, then you might want to do it the following 6 months. Yeah. But if the person is not, there are no features that make you categorize that person as a suspect, you see once in a year.
You said also that when it comes to childhood glaucoma, surgery is the number
It's
one.
the mainstay of treatment.
But why is it that? Why can't other means of glaucoma treatment be administered to them?
Yeah, there is for glaucoma there are different ways of treating glaucoma. Three major ways. We have drops, we have laser, and we have surgery.
Mm.
Okay. Now, if you take drops, for instance, and remember when we talk of childhood, we are talking of the span between 0 and 35
Mm.
when it comes to glaucoma. Now, if you take drops, for instance, for the very young that we call the primary congenital glaucoma, medications, because for those ones that develop early in life, they have a problem in the development of some structures within the eye. So it's a structural problem, and medications don't solve it. It might reduce the pressure a very little bit to allow you by some time before you do surgery, but they are not, they don't address the problem, and they don't solve the problem. So if you do medications, that the child is likely to lose the vision,
Whoa.
because it doesn't usually control the pressures, and more so those who develop like 0 to 15 years, the medications don't work. Now, even for the few it may work, how are you going to keep instilling it? The challenge of instilling medications. So the child, if you as a parent say, okay, I'm very diligent, I must, so whether the child is asleep or not asleep, you must put the drop. If the child leaves your side, then what happens?
What next?
The child is a child. If the child is, so the child will not go to boarding school, obviously, because who is going to instill it? The young people live very active life. Their lives are very occupied to be remembering to put daily eye drops.
Yeah.
And then many times, because of the nature of their eye drops, it is not what one drop will do. So which child, which young man, which young girl will keep putting drops 2 or 3 times in a day
for the rest of their lives?
Yes, from that age.
Wow.
So that is why, apart from the structural problem, we do surgery. We have not seen somebody who is a child started on medications who didn't lose vision, because it doesn't bring the pressures down to an acceptable level. It doesn't.
So you're saying medication works more for older people?
It works more for adult glaucoma.
Okay. So do the surgery automatically solve the problem?
The surgery addresses the problem in that it creates a channel for the fluid inside the eye to go out. Okay, which is the major problem they have now. And then for most of them, their surgeries tend to function better than that of adults, because of different reasons, including that their eyes have not been abused with medications. Eyes that have been abused with medications, which happens more in adults, by the time you do surgery for them, the surgeries tend to fail more than in children. I don't know if you get me.
Yeah, I do.
So the surgery done in children tend to succeed and last longer.
Any duration of how it lasts?
No, it lasts years.
5 years?
No,
15?
more than that. 15, 20.
Oh.
Yeah. But you must still keep going for checkups.
Yeah.
But for the much we have done, they maintain their pressures, good pressures, for very long time. Very long time. So the important thing is to get it done early enough. Get it done once it is discovered. Many times parents are afraid. I've had reason to shout on a father. It's not my style, but this child was discovered with poor vision. She was in secondary school, and by the time she was brought, she was diagnosed, and she had advanced glaucoma.
Whoa.
Both eyes.
Advanced?
Yeah.
Both eyes?
Both eyes.
Crazy.
She was like 12, 13 at the time. And she was advised, the parents were, she needed surgery. They say, let's just keep trying drugs. Let's keep trying drops. Let's keep trying drops. They tried drops. The doctor will say, do surgery. Let's keep trying. Try more, until she lost one eye completely.
Damn.
So it was remaining one. And you won't understand when I say that what was remaining in that eye was like a dot, like this solid FM, that circle, that solid circle at the center. That was what was remaining.
Damn.
So the doctor who saw her now referred that child to me. So the first visit with the father, I was saying, look, I showed the father, I said, see her visual field. Now, visual field shows you exactly what that eye is seeing, not just what has been damaged. So this is what that child. So I said, see, so just a little center is what this girl is seeing with. If nothing is done, this eye will go like the other one, and that she really needs to do surgery today or tomorrow. I mean, as quickly as possible. He said, okay, just put drops, some more. I said, everything has been used, so it's for you to make a decision. He said, okay, let them come back. I should give them an appointment. Then he comes back. And I thought he was coming back to, okay, let's go. And only for him to say, his people said that that children cannot be done, surgery can be done on children. I say, what's the meaning of your people? I say, who are your people? Were they there when you gave birth to this child? And with the child there, I say, I want you to know, because she's a minor, you have to give consent for her to be operated. She was about 15 then at this time. Wow. You have to give consent for her to be operated. As I said, this pretty little girl, I said, I want you to know that if she goes blind, you are responsible. I said, what do you mean? Are you not the father? You are in the position to take the decision. Who is my people? So I was really very upset with him. He apologized and said, okay, he will come back. He came back with his wife, who I think was a powerhouse, who believed, like powerhouse, including prayer house, that we are believing something will happen miraculously. So by the time, anyway, long story short, we eventually did surgery for that child, and her pressures came down. And with that tiny vision remaining, she finished her secondary school, entered university, read law, done law school, and out with that tiny vision. Even me, I'm amazed, at how she's been able to retain that little vision. So that is what for children, for young people, surgery is it. Now, for older children, I said 0 to 35.
Yeah.
For older ones, you could buy time with laser. Okay, there are some lasers you can do for them, and it can bring the pressures down. Now, because it needs the cooperation of the person to keep their head for you to apply quietly, for you to apply the laser. So for younger children, that doesn't work, because they are very they can't stay in one place. So laser works also, but the effect of laser is not
cannot be compared to surgery.
Yeah, it's not as permanent. So it's something you can repeat over time.
All right, ladies and gentlemen, you've had it. Quite a very interesting conversation we are having in the studio. All right, now let's get to open up the phone lines and take your calls and get your reactions. If you've got questions, feel free to ask. The numbers are 0704 550 2840 0909 771 1009, and you can also call 0902 311 1009. Okay, these are the numbers for you to call to be part of the discussion this morning. Hello, good morning to you. Hello. All right, do call back. Hello, good morning.
Yeah, good morning.
Can you move away from your radio set?
Yeah, I'm moving away from it. Yeah, I'm calling away from Agoi, but I mean, we are calling.
Can you move away from your radio set?
I'm away from. Can you hear me?
It's better now.
Okay. I said I'm calling all the way from Foglass.
Welcome.
Okay. What are the symptoms of this glaucoma?
What are the symptoms? Is that what you're asking?
Yes.
Okay. Doc?
Maybe we could take some more
Okay, all
questions.
right. Just keep listening. Doc will tell us. I'll tell you the symptoms of this glaucoma. More calls: 0704 550 2840 0909 Hello, morning. Yes, good morning to you.
Yes. It's from Basic.
Welcome.
Okay. Yes, I have a cataract.
Okay.
I go to the hospital. They tell me that I have a cataract. So I know using one of my eyes. Yeah. So that's why I'm calling. Let me know what to do about it.
Okay, you want to know what to do about it. You have cataract. All right. We've got a text. This one, yes, says, "Good morning, James. Chibike James. My name is Gregs. Uh, okay." It said, I had a date with a friend of mine, and before I got there, she told me she had to go check her eye pressure before meeting up with me, saying she was told her eye pressure was high and wanted to go check if the pressure has come down. Does that mean she has glaucoma? Okay. Okay, so Doc, let's attend to these questions before we move on.
Okay, thank you very much. Now, the question about symptoms of glaucoma, we had mentioned earlier that for the adult glaucoma and older children glaucoma, there are no symptoms until late in the disease process,
Okay.
at late stages of the disease, where somebody can now start having blurry vision, smoky vision, cloudy vision, or bumping into objects by the person's side. Okay, but for small children, for babies, for children less than 2 years, they have symptoms, and those symptoms, we said, watering eyes, excessive tearing, squeezing of the eyes, pain on exposure to light. The child avoids light, and then the cornea can be cloudy. So those are the symptoms for children. For older children, they usually wouldn't have until the eye is about being blind, where they bump into things and they don't see too well. Yeah, and then a caller from Ebonyi asked about what to do regarding the cataract he's been diagnosed with. For cataract, it's surgery. There's no medication for that dissolves cataract or that treats it. The only thing to do is to have the cataract removed. Now, sometimes I must mention, cataract coexists commonly with glaucoma.
Interesting.
And it's important to make sure that glaucoma is not there together with the cataract. Okay, cataract is more common as people get older. Glaucoma is more common as people get older. So that's
they can
why.
Go together.
So
well.
Yes, so cataract is the leading cause of blindness. Glaucoma is the second leading cause of blindness.
So anybody who's lost their sight having cataract, does that mean that the person has glaucoma too as well?
No.
Okay, cataract on its own can blind someone.
Yes, cataract on its own can blind an eye, but its own blindness is reversible.
Oh,
yeah.
Okay.
Yeah. So if
with
you
this
operate
person now
on
that
it,
has lost one sight, if they operate on it, he can get his sight back.
Yes, he say his sight is down now. But if cataract is allowed to overstay, it can become complicated and can lead to secondary glaucoma.
Okay.
And if that blinds the eye is gone.
All
right. So then the third caller asked, one who sent in message that does high pressure mean the person has glaucoma? No. There's something we call ocular hypertension, which can also, in which there's high pressure, but there's no evidence of damage in the nerve yet. Okay.
Yet.
Yet.
Okay.
So because raised eye pressure is a risk factor for developing glaucoma. So if it is discovered early, before it starts damaging the nerve, then there's no glaucoma. You can treat that ocular hypertension and keep it down, and it doesn't get to cause glaucoma.
All right.
But it could also mean that she has glaucoma.
All right. Doc, let's wrap up. Or if there is one message that our listeners will take from today's discussion, what will it be?
Glaucoma can affect any age. So watch out for the warning signs in your children, your teenagers, your growing adults. Perchance there's sign of glaucoma. Have them do their eye tests as at when due.
All right, have them do their eye test as at when due. Well, ladies and gentlemen, that's how we'll wrap up today's conversation. Yes, we still see your calls, okay? But please, if you have concerns about your child's eyes or would like more information, please contact the Eye Specialist Hospital Tesh on 0809 700 2020. For those of you calling right now, you can also call this number if you want to, know more and get to have your questions answered. 0809 700 2020. I want to say thank you for listening to Glaucoma on Radio, proudly brought to you by the Eye Specialist Hospital Tesh in Enugu State in partnership with Solid 100.9 FM. Well, until next time, remember that your eyes, when it comes to your child's eyesight, early attention today can help protect the vision of your child tomorrow. Doc, thank you very much.
Thank you very much.
Alright, we'll see you same time, same station next week Friday. Do have yourself a blessed weekend. Bye bye.
Hey out there, Radioland, you're listening to the best station in the city. Don't touch that dial. We got music from morning, noon till night. With all your greatest hits here on the station that rocks.
Hey, my people, how on a day? I won't welcome every